Hello, 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 hello. Good, good evening, fellow friends and loved ones. It's once again a very good evening. Yes, I'm very honored to come to your homes this evening, um, to continue our weekly discussions on various health conditions. Yes, um, my sincere apologies for this Sunday that just passed. We weren't able to have a discussion because of some technical problems, but I trust that you stay tuned in our subsequent discussions. Thank you very much for your time. Thank you very much for your time. Yes, so we discussed that was last week Sunday on a condition called lymphedema, and then we scheduled that was this past Sunday to talk about a condition called post disease, or commonly called spinal tuberculosis. But then we weren't able to have discussion. But thank God that today is Wednesday, the 9th of June. We are privileged to have that discussion. And I'm sure you will have a wonderful time even as we follow on. You can also share the page for other people also to join in our live discussions. And then if you have any questions, yes, they are warmly welcome. They are warmly welcome. Thank you very much for your time. So we begin this presentation in the name of the Father and of the Son and the Holy Spirit. Okay, so today we're talking about a condition we call pulse disease, or we say in plain term spinal tuberculosis, and it presents itself with some curvatures at your back. So delve into more deeper understanding of this condition. And so we begin this condition. This condition is called pulse disease, and it's described by someone called Port. And then so this came about the name called pulse disease. So some of the conditions in medicine, due to those who discovered it, they attribute them and then they give them the due acknowledgement. And so this condition is also no exception. It's medically called spinal tuberculosis because some attribute it to some tuberculosis presentation. So spinal means your spine. I'm sure you've heard about your spine before, but then your spine is actually at your back. Yes, there are small bones at your back that are arranged in order. We call them in medical term vertebrae. They are small bones, and these keep your body in a very good shape. In a small curve at your neck, a small curve at your upper back, a small curve at your lower back, and then this helps also to absorb shocks with presence of something we called intervertebral discs. So they are like cushions that protect the small bones at the back from coming into contact with each other. So these bones, when they don't come against each other, they don't cause pain. And so within these bones, we have spaces also we call canals, foraminal canals, and these spaces are where the spinal cord passes. So the spinal cord comes from the brain, it connects to the brain, and then goes down. The spinal cord is a long structure. It's a long structure like a thread, but it's thicker than a thread, and it goes from the neck area right down to your back and goes down to your lower back, and it ends there. And there's a structure we call the cauda equina. These are all structures that I'm sure they are so. It might be so big a word for you, but then just let's understand it as it is. And then after the cauda equina, you have small nerves that go through into your legs. These nerves are actually good for sensation, so they help you to feel. And so when there are distractions in terms of the normal alignment of the bones, the bones begin to cause the malalignment, that is wrong positioning of this spinal cord, and immediately this is caused. This could result in what we call the pulse disease, or other conditions or other causes which we'll be discussing very soon. Okay, so what is pulse disease? So it's actually medically also termed as spinal tuberculosis or tuberculosis spondylitis, and it's termed tuberculosis spondylitis because some people attribute it to infection. So anything that you hear itis, it is an infection. You have osteomyelitis. We've talked about osteomyelitis in a previous presentation, and we have encephalitis. We have so many litis, and I can't mention all of them. And so it's actually a rare infectious disease. Um, it could be infectious. It could also be as a result of aging. It could as a result of trauma to a particular portion of the vertebrae, especially the upper part. But then scientists have, by research, realized that it's more of infectious than to be as a result of trauma. So they are attributing it to infectious disease, which is actually a rare type that affects your spine. So basically, the middle part of the back. But then the condition presents itself as curved at your upper back. We will see some pictures in the various investigations that are carried out to be able to see how this presents itself with a curved upper back, while the condition actually affects the middle back. We will understand why. So let's just stay tuned to understand with the picture that will be shown very soon. Okay, so actually this condition affects the bones, and then when they get worn away, some lose their normal alignment, and this will cause the spinal cord to be impinged, that is the spinal cord to be affected, and this could cause so many conditions. If you even have this condition called pulse disease, it could result in condition that we'll be talking about very soon. And so when the normal structure of the back is altered, that is tampered with, the actually, so let me just give you a brief posture of the back. So at your back, you have your neck curved in this way. Okay, so your neck is curved this way, so your neck is curved in a C-shaped. So you can put your hand here, your back is curved this way, and your upper back is curved this way. So when your back is curved this way, your upper back is curved this way. So they sit this way, and your lower back is also curved this way. And the fact that your back is not so straight is very important to absorb shock. If your back is straight, the shock just goes directly to your neck into your legs, and this will cause so many destructive phenomena, and it could result in so many conditions. And so God in his own nature has made our back curved so that we can absorb shocks. But then we have this spinal cord at your back, which actually is very sensitive. So when these curves are altered and they begin to push more curve inside, this will cause this other complications, which we'll be talking about very soon. And so it will cause something we call kyphosis, which if you've not talked about it, I'm sure we'll talk about it soon. But then kyphosis is actually a, an exaggerated curvature of your back. That is too much curve at your upper back. And so this condition could present itself with too much curvature of your back, which will be delving into it very soon. And so some effects of having this condition called pulse disease is actually, it could have fractures, that is, you could have the bones being broken, and this could cause so many complications. And then they could have total loss of movement at your lower legs, so you could have weakness in your legs, and then you could also be paralyzed. Yes, this condition is actually really severe, though very less of the population are likely to have this condition. So when we talk about which people are more affected, so many statistics have been carried out, but in 2005 it was shown that the whole world, about 8.8 million people were likely to have tuberculosis in the world. That was some few years ago. The population was about 3 billion people in the world, and so just imagine 3 billion, that's 8 million people out of 3 billion. That's like insignificant. But then when we come to realities on the ground, there are quite a number of people, 8 million people in the whole world. But then it's shown that about majority of the people are from Asia, and then some people are from sub-Saharan Africa, and they are more likely to have this condition called the pulse disease, or the spinal tuberculosis, or scientifically called the spinal spondylitis. That is where we have inflammation of this condition. Okay, so um as we said, very little people are likely to affected by this condition. It could affect the bones at your back, and this could have curvature of your back, and it could look like some the those who have hunchback. So let me put this straight to us to understand that if you have or seen someone having hunchback, it doesn't mean it's he was actually born with, but then it could be as a result of this condition called the spinal to spondylitis or the pulse disease. These are all adverse effects of having this condition. You could have hunchback, and so if you look at ethnicity, it's shown that it affects more Americans and Africans. Yes, on the ratio of more Africans are affected. Yes, and so a research was carried out in Japan that showed that, in fact, as technology was